Moment, ladies and gentlemen, we are going to be introducing to you the first topic of discussion for the day, which very much is the Saudi Lab Expo 2016. Saudi International Lab Expo was a three-day event from the 21st till the 23rd of November 2016 at the Riyadh International Convention and Exhibition Center. Now, the event showcases products like the latest laboratory equipment and instrumentation, equipment, technologies, and whatnot, just about everything that is related to chemistry and laboratories. Let us move on and take a short look at the report that we have prepared for you, after which we're coming back to you with our guest. Stay tuned.
I'm head division of toxicology and biochemical metabolic lab at King Abdulaziz Medical City. Actually, this is very special event and organized. We are handling right now a second conference organized by Saudi Society of Clinical Chemistry to discuss the recent guidelines and updates in lab practice related to abnormalities in lipid profiles, cardiac biomarkers, and also we are discussing the quality and safety in lab practice. It's very important, as you know, we are gathering in all the people, actually, all the personnel and working in laboratory medicine. They are meeting at different levels, at medical technologists, clinical scientists, and MD consultants to discuss all the updates in lab practice. How can we improve it? How can we interpret and improve our current practice to meet the clinical needs? I would like to encourage, actually, and I would like to thank all the organizing committees for such important event, and encourage such events in the future to be organized. It will help, actually, to improve the laboratory practice in Saudi Arabia.
Welcome back once again. You're still tuned to the Saudi Morning Show. So news updates are coming into the studio that it is raining outside. And of course, we certainly do understand that because Riyadh city is so big that it could be raining in parts of Riyadh. But right now, we are very much in the heart of the city of Riyadh, as we are in the central part of Riyadh city. It seems to be really raining and pouring around us, but well, we hope that wherever it is that you are leaving to from your homes right now, that you are going to be more careful and more cautious on the road. Mobile phones and cellular devices should in any case not be used on the road, but nonetheless at times of rain, especially where you are suspecting that it could be thunderous or there could be let's say short streaks of lighting, you have to be extra ultra cautious and careful too. But anyways, with this, moving on towards our first subject of discussion for the day in the program, where we are talking about the Saudi International Lab Expo, which was a three-day event held here in the city of Riyadh. Joining us here in the program to talk more about it is Mrs. Halima Al-Madani. She is a senior scientist and an expert with metabolic and newborn screening programs. Assalamu alaikum and a very good morning to you, Mrs. Halima. Thank you for joining us.
Thank you. I'm proud today to come and talk about something happening in Kingdom, and always it's this conference regularly done by societies of Saudis.
Indeed. Now, Mrs. Halima, tell us more about the Saudi Society of Clinical Chemistry.
Saudi society is one of the society in the kingdom which newly established in 1435 under Saudi Commission of Health Specialists. This Saudi Society of Clinical Chemistry, member of International Federation of Clinical Chemistry, and it's also increased of the member, about 1,000 member of different specialist technicians, clinicians, scientists, and every interested one.
Right. And ma'am, if we can ask you about what are some of the most important services that the society provides?
Really, this Saudi Society of Clinical Chemistry play a very important role in all health worker in clinical chemistry. For example, it's increase awareness of society about clinical chemistry and its role in pathology. Exchange experience between the members of this society and other societies, and also its organization, make organization of scientific conferences and workshop around kingdom. There is a cooperation participation between the member about the scientific researches. Also, there is continuous education, medical education for all members, which increase and improve the lab service. And it's increase and improving the patient care and saving patient life, inshallah.
Indeed. Now, Mrs. Salima, also tell us about the conference.
This conference done by Saudi Society of Clinical Chemistry. It's not first conference. Also last year, it's organized conference in 2015, and this is the second one. In the present, about 700 specialists in this conference.
Right. Now, Mrs. Halima, if you would tell us about some of the main speakers who are present at the conference and speaking.
It's different speaker. We have international speaker. We invite them to our conference to have international experience from them. And also we have local speakers from different hospitals, from different countries coming in the area to present their presentation.
Indeed.
Fantastic.
And Mrs. Halima, how did you find the turnout of the exhibition and the conference both?
During conference, we have Saudi Expo, which all medical company introduced the most recent equipment during this expo, which help us also to improve our lab service and improve the equipment in the lab.
Right. And Mrs. Halima, we are running out of time now, but we would really like to ask you if there is a message that you have for people who are watching you. It can be just for your family or friends, or maybe to the students who are interested in chemistry.
Really, any professional can knows about like Saudi Society of Clinical Chemistry. We have cooperation for international society also, and any professional can register in this clinical chemistry to have a good experience during website www.sscc.med, and this registration for free for anyone and can read about clinical chemistry, take experience from us.
Indeed.
Inshallah.
But Mrs. Halima, let me ask you as well, because for each person they choose their different careers and different specialities.
Yes.
How was it that you chose biochemistry? Because biochemistry, as we understand, I mean, for a lot of the people, when they are going through phases in their school, in college and university, there are some students who generally like, let's say, mathematics, accounting. There are some students who like the logic behind physics. Chemistry is really, really very difficult because it has science along with maths, and it's all linked together. So tell us as to how it is that you find
It
it.
depends on how it's feel the student or what's like. Clinical chemistry, it's part of clinician or clinical. It's really science and clinical together. It's not easy, but it's interest. If the student know in future he will improve the caring of the patient and improve the patient safety. So it's depend on the person who study what he's like. So.
And now, Mrs. Halima, currently Saudi Arabia is having a strong focus with its Vision 2030 of creating as well more opportunities for Saudi Arabia in general and for Saudis in particular. Do you think that in the field of biochemistry there are lots of opportunities for the young Saudis maybe who are still looking for their majors and they're thinking about which career path is going to be more rewarding for them?
It's the important thing for our focus in or objective in 2030 for clinical chemistry, and everybody have to know increase the patient safety and make zero medical mistakes for the patient and saving the patient life inshallah as we can by giving a correct result in a good time, so that the doctor can easy and quickly start treatment of the patient, and this one it will be increasing patient safety. That's our objective in future of 2030 inshallah, like everybody think about.
Absolutely, that is fantastic. And Mrs. Halima, we are going to be coming back to you, but for the moment, ladies and gentlemen, let us embark on towards a report which is very much relevant to the topic and where we are going to be seeing much more in-depth view of what was happening at the Saudi Lab Expo 2016. Let us move on towards this report, after which we're coming right back with you.
Yes, my name is Subramanian Dharmaraj. I am the marketing manager for Integrated Modern Scientific Supplies. We are a distributor for analytical equipment in Saudi Arabia and also the rest of the Middle East. This is turning out to be a really good event for us. This is the second time Saudi Lab Expo is being held in Riyadh, and we participated last year also. What we find really great about the exhibition is the fact that we have customers from all different segments, from the oil and gas sector, from the healthcare segment, from the academic segment, mining, minerals. We also see a lot of students. So a lot of the customers that we typically cater to, they're all coming to one spot in this exhibition. So that is really good for us. And very clearly, this is a very well organized exhibition, because we also participate in Arab Lab, and Saudi Lab Expo, I should say, is as equally or better organized than Arab Lab. It is very, very well done. This is the second time, because we attended Saudi Lab Expo last year also, and it has been a really good experience for us. Yes, this is a great exhibition. I think we will continue participating in the coming years, and looking forward to having such a great experience going on.
Welcome back once again. So, well, we were taking a look at the Saudi International Lab Expo, which was a 3-day event taking place in the city of Riyadh. But joining us here in the studio is Mrs. Halima Al-Madani, and she is a senior scientist and an expert with metabolic and newborn screening program. So, well, actually, Nihat seems to be very, very intrigued about this program. So, Nihat, I'd give it away to you to ask more details about it.
Well, for me, I think babies are very fascinating, and because they're so small and fragile. So, Mrs. Halima, you very much have your specialization in metabolic and newborn screening program. Yes. Now, we do understand that as just people who see newborn babies, we understand it's so complicated. They're so little. They cannot tell you what's wrong with them.
Know, yes.
So, please tell us, what exactly is this program, your specialization? What does it do?
We talk about Saudi Society of Clinical Chemistry, and I work in clinical chemistry, and this metabolic lab or newborn screening lab under this our clinical chemistry. This investigate all the baby born in Saudi Arabia, especially in MOH, for genetic metabolic diseases, which can affect the baby because the relative marriage in our culture, we have high incident for this 1 to 1,000 incident of the baby. So we try to avoid and treat it early. So if we make a newborn screening program for all the baby, we can investigate early, and the doctor start to treat early for first few days, and it will be saving the baby, inshallah, for any mental retardation in
Now,
future.
Mrs. Halima, is this standard protocol, the newborn baby screening program, is it done for all of the newborns?
Up to now, 80% of newborns, baby born in Kingdom, yes, it's done, especially in MOH and other hospital like Prince Sultan Medical City and National Guard, King Faisal Special Hospital. All this, they done a newborn screening program. Second phase, inshallah, it will be the private also, it will be done there. Some private started already.
Right, but Mrs. Halima, here, let me ask you, as you mentioned, the number of the newborn babies who are born with metabolic conditions to be 1 in 1,000 births. Now, let's say when we speak about the Kingdom of Saudi Arabia, as you mentioned, that there are many marriages within the families. Now, Saudi Arabia implemented this premarital testing program. Do you think that the number and the figure that you quoted, which is like in 1,000 babies, one to be born with metabolic complications, do you think this number has gone down? Before it used to be more until they implemented the premarital testing program?
Premarital is another program which avoid another infected disease and other genetic diseases, completed with the newborn screening program. Altogether, it will help to reduce this number in future, inshallah. Both programs very important together. It have to be combined, and we have to have a good study for both of them, and both it will help to reduce this number. Yes.
Right. And Mrs. Halima, when we talk about the metabolic screening program for newborn babies, is this one which is mandated by the Ministry of Health? That means that it's let's say obligatory part of protocol for any newborn baby who is born in a Ministry of Health hospital.
Yes.
So that means that it does not call for a consent from the parents or anything.
No, it's mandatory for all babies born in Ministry of Health, to be done.
This is remarkable, and then we hope, inshallah, that once this program is furthermore going to even the private hospitals and reaching out kingdom-wide by all possible means, would be able to, inshallah, hopefully almost even eliminate the number of newborn babies
we hope so,
who are going to suffer.
We hope to reach 100% for all babies born in Kingdom to screen, inshallah.
Inshallah. And on that note, we really thank you, Mrs. Halima, for giving us so much time, for actually raising awareness about this very important program as well. We wish you all the very best with your specialty.
Thank you very much. Thank you. I'm proud to be with you today to talk about two parts, and I hope we have to have a good education program for clinical chemistry and newborn screening program and all genetic diseases and every specialty, inshallah. This our future for healthcare worker.
Indeed. Thank you so much,
Thank
Mrs. Halima.
It was our absolute pleasure to be hosting you, Mrs. Halima. We are looking forward to having you again on the morning show. For the moment, ladies and gentlemen, it is a wrap. We were in discussion with Mrs. Halima Al-Madani. She is a senior scientist, and her specialty very much is metabolic and newborn screening program affiliated with the field of biochemistry. Now, we are going to be concluding this session of our program about the Saudi Lab Expo 2016. Let us move on to it, a short break, after which we are coming to you with our Twitter segment. Stay tuned.